Morning, everyone. I'm going to go ahead and get us started at the top of the hour. If you tune in a little later, that's totally fine. Feel free to watch the recording later to skip back and see what you missed. My name is Celeste Prawl, and I'm the Administrative Coordinator for the Equality State Policy Center, a nonpartisan nonprofit organization working to improve the lives of Wyoming's people through transparent government, fair elections, and thriving communities. Tonight, you're joining us for our People's Review Live, which is designed to help people across the state engage with our government and keep up on important issues. When we work together, we can ensure transparent government, fair elections, and thriving communities. This event is made possible by our generous donors who are part of the People's Review Live Circle, including Marcia Kunstell, Joe Albright, Joanne Skyamtrue and Shane True, Mike Chauncey and Kathy Jenkins, and an anonymous donor. If you'd like to know more about how to become a Leadership Circle member, feel free to message me. I will drop my email in the chat here in a second. And then a little bit of housekeeping. We are in webinar format, so ideally you can see and hear me right now and all of our lovely panelists. If you're not able to see and hear us, feel free to shoot me a message and we will work through that. And then you can submit your questions via the chat or the Q&A feature at any point throughout the evening. With that, I will welcome our lovely moderator, Jan Cartwright, and I'll hand it off to you.
Thank you so much, Celeste. And thank you all for joining us tonight. I'm very excited to, and it's my great pleasure to introduce our panelists before we jump into the actual discussion. So first, I'd like to introduce Laura Guerra-Cardos. Laura is the Director of State Medicaid Strategy on the health team for the Center for Budget and Policy Priorities. Prior to joining the center, Laura served as the Deputy Director for the Children's Defense Fund, where she helped lead Texas partners, coalitions, and campaigns to advance health equity for Texas children and families. Her efforts helped expand coverage for new mothers, streamline eligibility systems for children, and reduce Texas's child uninsured rate from 17.6% in 2008 to an all-time low of 9.8% in 2016. Laura is a graduate of Rice University and Baylor College of Medicine in Houston, an alumni of the Children's Health Leadership Network, and an alumni of the Coro Fellowship Program in Public Affairs, St. Louis. In 2022, she received the Families USA Consumer Health Advocate of the Year Award for her leadership and commitment to health equity. Our second panelist is Bruce Palmer. Bruce is a longtime Lander resident, arriving in 1990 with his wife Peg and two kids, Clay and Cole, for what they thought was going to be a couple of years in the Wild West before skedaddling back home to Massachusetts. 30 plus years later, the Palmers are still here. The family expanded by one with the addition of Lauren in 1994. Bruce worked for Knowles, or the National Outdoor Leadership School, from 1990 until 2018, directing the school's marketing and admission efforts and serving on the executive team. Since 2018, Bruce has worked as a political consultant and is currently fighting for Medicaid expansion as the director of the Healthy Wyoming Coalition. Bruce is the board chair of the Lander Free Medical Clinic, an effort that aligns perfectly with Bruce's belief that access to healthcare is a right and that no person, regardless of where they live or how much they earn, should be denied the care they need to live fulfilling and productive lives. And last but not least is Marrissa Carpio. Marrissa is the advocacy coordinator of the Wyoming Women's Foundation, a priority fund of the Wyoming Community Foundation. In her role at the Women's Foundation, she works to advance systems change with statewide advocacy, grassroots organizing, research, and collaboration. The foundation aims to pursue greater equity for women and girls in Wyoming. When women and girls prosper, communities thrive. So thank you all for, oh no, never mind. So I think that our panel order is to start with you, Bruce, to make give a presentation, and then we'll have Q&A after that. Thank you.
Great, thank you. I'm going to share my screen, I think. Let's start to. Can you all see that? Is that something y'all can see?
No, we can't, Bruce.
You can't? Oh no. Why is that? Can you see that?
No.
Ah.
How about we take a moment and be flexible and we can kind of reorder, and you can email me that PowerPoint and I'll get that set up, and then Marrissa can go ahead and go first. How's that sound?
Okay, that sounds groovy. Sorry, team.
It's all right. Marrissa, whenever you are ready, you should be able to share.
Okay, let me pull it up here. Okay, can you all see that?
Yeah.
Okay, well, it's not letting me present now. What is happening? Huh. Hold on, let me try. Oh, there it is. Okay, good. Okay, hi everyone. My name is Marrissa Carpio. Like Jan said, I am the advocacy coordinator for the Wyoming Women's Foundation. So I wanted to thank ESPC, Jan, Bruce, Laura. Everyone is so awesome and doing such great work. So just being a part of this panel means a lot to me and to the foundation. So thank you. So our mission is to invest in the economic self-sufficiency for women and opportunities for girls in the state of Wyoming. This mission ties closely with Medicaid expansion and the postpartum benefit extension, which I'll explain through my PowerPoint. The part that might be a little bit confusing is the pregnant eligibility is different than overall Medicaid eligibility, which Bruce will touch on. So it might be in a little bit reverse order. So if you have any questions, just wait until maybe Bruce does his, and those hopefully will clear up some of those. So not only do women need health insurance, mothers need health insurance. Healthcare for common health complications that arise during, before, and after birth. It's so important to have that access to healthcare, access to health insurance, so that women can have preventative care before those issues worsen. In doing that as well, you're alleviating the financial and health-related stress. If you're pushing off these issues and they get worse and you go to the emergency care unit, you're not only likely to worsen your health state, you're likely to worsen your financial state, and therefore it will be harder for you and anybody else to attain economic self-sufficiency. So again, this is tied closely with the issue of Medicaid expansion and the postpartum benefit extension. Like I mentioned before, Wyoming has a specific eligibility for pregnant women in the state. This is called the Wyoming Medicaid Pregnant Women Program. To be eligible, you have to be pregnant, income eligible at or below 154% of the federal poverty level. And I'll illustrate that a little bit in the next slide so you can kind of see what that actually looks like. You have to be a U.S. citizen or lawfully present in the U.S. and a Wyoming resident. And so here, it's a great program, but here's kind of where we run into the issue, is that coverage only lasts up until 60 days postpartum. So after those 60 days, a lot of women are unenrolled in a time when it's crucial for them to have access to healthcare and health insurance. This is a little bit of an illustration on the federal poverty level. To qualify for the Wyoming Medicaid Pregnant Women Program, like I said, you have to be at 154% of the federal poverty level. For a family of two, think of like a mother and a child, they have to earn at or under $26,000 approximately per year. However, to be self-sufficient, which is, as I mentioned in our mission, that's the goal of the Wyoming Women's Foundation. That means you're making enough money to make ends meet. You can afford childcare, healthcare, groceries without any public or private assistance. A mother with one child must make $37,500-ish per year. I also wanted to note that these numbers are from 2020. Since we haven't updated the self-sufficiency standard, those numbers were likely to be a little bit higher now due to inflation. The federal poverty level has updated, but just for comparison's sakes, I kind of left it at 2020 for this one. I also just wanted to show that there is a gap. So even though 154% sounds like a lot, especially when you're comparing it to the 138% for Medicaid expansion, it's not even close to meeting self-sufficiency standards. So it's still $11,000 away per year to be able to make those ends meet. This interim session, the Wyoming Department of Health presented to the Labor, Health, and Social Services Committee. What they presented was that there are around 6,000 births in Wyoming per year, and about a third of those, especially for the past several years, have been Medicaid births. So in 2020, 1,993 of those births were Medicaid. It means the mothers were on Medicaid, the Medicaid Pregnant Women program when they gave birth. This is important for several reasons. The number one would be insurance churn. Insurance churn, it's hard to say. Insurance churn essentially means that it's a cyclical effect when people are disenrolled or transition to other health coverage due to eligibility. So before pregnancy, we can look at that number. The orange means that a woman is uninsured, and the red means that they are on Medicaid. So that no health insurance, that's pretty high. It's almost 20% before pregnancy, drops down to around 5% during, and then goes back up to almost 20% afterwards. What this means is that after birth, I think this is from the Wyoming Department of Health, the same presentation, and this after pregnancy, I think, is about 3 months postpartum. So it's past the 60 days. It means that women are unenrolled and they lose health insurance. It doesn't mean that a lot of them transition to other health insurance. It means that the majority of women lose health insurance completely. So that's very important, especially for the impacts on women seeking healthcare postpartum. As I mentioned before, 60 days is not enough. Some pregnancy-related morbidities, such as cardiomyopathy, don't appear, they're not resolved until after those 60 days post-birth. The CDC even recommends 2 checkups, one within 3 weeks of giving birth and one within 12 weeks of giving birth, which is 4 weeks past those 60 days. So it's essential for women to have healthcare to get those 2 necessary checkups. We also see significant disparities in loss of Medicaid among postpartum women. Historically, Indigenous, Black, and Hispanic women lose insurance after birth at a much higher rate than white women. So it's important that we are making sure that women in those vulnerable groups have health insurance and access to healthcare. Lastly, 1/3 of pregnancy-related deaths occur between the 1 week and 1 year postpartum date. In that same Department of Health presentation to the legislature, they presented that 3 of 6 pregnancy-related deaths in Wyoming over the period, I think it was 2018 to 2020. Those women, half of them had lost insurance in that period. So at the time of death, they were without insurance. And this is where the Medicaid temporary 12-month postpartum coverage. So I know that's kind of a mouthful, but that's the bill title of the committee-sponsored bill. In April, the Women's Foundation, along with a couple of other organizations and legislators, submitted an interim study topic. That means over the course of the interim session, which is just between the 2 legislative sessions, legislators met in committees to study special topics, in this case maternal health. One of the solutions that were presented to the committee in the beginning was to extend this Medicaid coverage from 60 days to 12 full months after birth. That was successful, which is great. So it's a committee-sponsored bill, and it'll go into the general legislative session starting January 10th, depending on when it gets introduced. And the Women's Foundation, along with, I'm sure, a whole host of other organizations, will be following that and supporting it as well. Some of the details within that bill is that it will become, if it gets passed into law, it will become effective July 1st, 2023, and it will expire March 31st, 2027, unless acted upon otherwise. So there is an expiration date on this just due to federal funds. Speaking of federal funds, historically, the postpartum benefit extension was through Section 1115 waiver, which I won't go too far into that, but the only thing you should know, and I'm sure Bruce and Laura maybe will shed some more light on that, but essentially the state plan amendment that was introduced through the American Rescue Plan Act has been a lot more simple for states to adopt. Federal funding requirements are very clear. It's simple for states to adopt and send in. There isn't, it's not as time intensive as the Section 1115, and there's full coverage for pregnant women. So not only is it good for states, easy for states, it requires full coverage for that 12 months without any exceptions for pregnant women under those eligibility guidelines, of course. I also wanted to make a small note. Of course, we haven't talked explicitly about Medicaid expansion yet, but there is a difference between the postpartum benefit extension and expansion, and that just exists within the word extension and expansion, which are extremely similar words, so it can get confusing. The postpartum benefit extension extends the benefit that already exists for qualifying individuals. So it doesn't actually change the qualifications that you need to get into the pregnant women program, but it just extends the amount that women are covered. In Medicaid expansion, it actually changes eligibility requirements, which again, I think that Bruce will talk about, so that everyone who's under 64 and falls under the 138% of the federal poverty level will be eligible for Medicaid. So when you think about it, think of extending a time versus expanding eligibility requirements. And the Women's Foundation supports both of these measures. Full Medicaid expansion would benefit working women in Wyoming. So working women under 35 of reproductive age make up one of the largest groups in the Wyoming's coverage gap. According to our gender wage study, newly hired women are also less likely to be offered insurance from their employer compared to their male counterparts. And then lastly, women are more likely to be working in low-paying jobs, such as part-time jobs, without an option for employer health insurance. So public-funded health insurance is very important for the success of women. And again, once you invest in women, communities thrive. And so there's my list of resources. If you guys are interested in anything, feel free to reach out to me. I don't know, Celeste, if we're going to send this out, or if you guys have any questions about those resources, just let me know. Again, my name is Marrissa. I'm the advocacy coordinator for the Women's Foundation. If anything in this slide deck interested you and you want similar information, just use this QR code to sign up for our mailing list, where I talk about a lot of advocacy related things, but especially the postpartum benefit extension. Thank you.
Well, thank you, Marrissa. That was a great presentation. And now we'll turn it back over to Bruce, if you're ready.
Maybe. We'll see exactly what happens. Okay. Yes. All right. It was pushing the little share button at the bottom that made all the difference in the world. So anyways, yeah, I wanted to give a little bit of an update on expansion in a broader sense. And I think Marrissa did a nice job of going through the extension piece. And that's been an ongoing conversation here within the Wyoming the Healthy Wyoming Coalition. Are we able to differentiate enough that we can be in favor of both, which we're in favor of, but do we want to advocate for both and keep it straight? So anyways, we are moving forward with both. And as I said, Marrissa did a nice job of explaining that. So I wanted to give just a quick little history of Medicaid expansion in Wyoming. In 2013, this is a picture from 2013. And I thought it was interesting when I pulled the picture up today. That's me in the middle with the orange coat on. It was about 20 below zero that morning when we were out there. And then I'm looking around and going, Hollis Hackman is still just wearing a sport coat. But he was I was kind of a rabble rouser. Hollis is with the Wyoming Psychological Association, was there lobbying. And then I was noticing that on the far left-hand side, Dan Neal, who at the time was the director of the Quality State Policy Center. So anyways, in 2013 is when we started pushing for this. And probably even a little earlier than that, but 2013 was the meeting in Lander where this picture was taken. And so we had an opportunity way back then to expand Medicaid, and a lot of folks would have benefited from that. But the legislature was not willing to do so. I know, Jan, we, both of us heard a lot about how there had to be a Wyoming solution to healthcare access issues. And so we've been waiting and pushing and pulling, trying to get ourselves to a spot where we actually address the healthcare access issues, but to this point, we still haven't. And so I think it's just important to consider how long this fight has been going on. And we're getting ever closer at this point, but still feeling like we have a long way to go too. At that time, back in the early 2015, the map showed quite a few states that had not expanded Medicaid. And so many of our neighbors had not expanded Medicaid at that point. However, it's changed now. And we're kind of in the middle, we're lonely out here at this point. Still in the South, a lot of the states have not done the Medicaid expansion, but here in the Intermountain West and in the Midwest, most states have, with a few exceptions, and we sadly are one of them. So Marrissa had mentioned, eligibility for Medicaid and things along those lines. So I have a little Medicaid expansion quiz. It's just a few questions. The first question, to the point that Marrissa was making, is who is covered by Medicaid as it is currently administered in Wyoming? So I'll ask folks to raise your hands. Children whose parents earn less than 200% of poverty level, are they covered by Medicaid? Yes, they are. Pregnant women with income below 154% of poverty level. Yes, they are. Individuals who are aged, blind, or have federal disability determination with a limited income. Yes, they are. Working low-income individuals. No, they are not. Individuals who experience a catastrophic health event and can no longer work. A woman with breast or cervical cancer and income below 250% of poverty level. I think they are, yes. No? Am I wrong, Jan? I think they are.
Okay, I'm not. You're the expert here.
Trying to be. But anyways, I think what this illustrates is one of the misconceptions that I think a lot of people here in the state of Wyoming have is they think low-income individuals, just by virtue of having a low income, are eligible for Medicaid, and that's not the case. They have to have some other determination or status in order to be able to be eligible. And so that's one of the reasons why we're pushing on this. So what is the federal poverty level for a family of four? $27,500, $35,000, or $44,000? If you said 27.5, you would be right. Who pays for Medicaid expansion? Mark all that are correct. Is it the federal government, the state government, or I do? And the answer is all of those through our IRS contributions that we make every year, through our income tax, all that money goes in, and many states around us, most states around us, are getting the benefit of those dollars that are paid in. In terms of the mix of money for an expanded Medicaid program, 90% would be paid by the federal government, 10% would be paid by the state government. So those are all our dollars. And the Wyoming Department of Health estimates that how many Wyomingites would be eligible for expanded Medicaid? 12,000, 19,000, 27,000, 55,000. They're not sure. And so their estimates range from 12,000 to 27,000. Within the Healthy Wyoming Coalition, we have been using the number 24,000 as kind of a mid spot where we think it would probably end up. But there's the Wyoming Department of Health has done a lot of different computations trying to arrive at some different scenarios so they can figure out the feasibility of expansion. And what is the expected cost to the state of Wyoming for Medicaid expansion per biennium? Nothing, 17,000, 22,000, or 26,000. And again, we don't know for sure. The best guess is that it would be $22,000 per biennium. But the fact is, with the current kicker that's in there through the American Rescue Plan, it would probably be zero, actually. While the state would need to kick in money, we would be saving money on our FMAP for regular Medicaid. And so we would actually come out ahead. And the best guess is that we would actually come out probably 32 to 34,000, 32 to 34 million. Oh, and that's right. All these are, it's not 17,000, it's 17 million, 22 million, 26 million, sorry. But anyway, so it would be 34 million to the good if we were to expand Medicaid. Excuse me for my lack of zeros. So in 2022, we've been pushing forward on Medicaid expansion. And just to take a little step back, in 2021, we passed the House for the first time with Medicaid expansion. It failed in a vote in the Senate Labor and Health Committee, so that's where it stopped in 21. It was reintroduced later in 21 when we had a special session by the Revenue Committee, but it didn't go anywhere at that point. In 2022, we were in a budget session, and we would need 2/3 to get it to the floor. We were unable to get that done. That said, we did do a lot of very good work in terms of establishing our grassroots, building our grassroots. The photo in this slide is a rally that we did at the Capitol on the opening day of the session. And I think, you know, we are making progress as we're moving toward 2023. We have gained advocates in the legislature. In this shot, you can see Senator Cale Case, who's been a very vocal advocate for expansion. You can see Representative Mike Yin in the background there, and this is also at the rally. But we've made good connections. We have good proponents within the legislature. The other thing that I think is very positive is the messaging that we're producing around Medicaid expansion is being used both by our legislative proponents and also by the media. We've also done polling, and we know that the people of Wyoming want this. Nearly 2/3 of Wyoming voters are in favor of Medicaid expansion. 58% of Republicans are in favor of Medicaid expansion. 67% of Republican women are in favor of Medicaid expansion. And I think a lot of this is due to the work that we've been doing to educate the public, educate legislators, so forth like that. We've also, through our polling, found that roughly 1/3 of Wyoming people are feeling like healthcare is one of their top issues. And so that's important for us to know. And again, I think it's because we've made people more aware. Plus what they're seeing on the ground. We're seeing maternity units closing at hospitals in Wyoming at this point. We've seen behavioral units close, behavioral health units close. And so it's in front of people and we're seeing it. So that's kind of where we sit at this point, is that we keep pushing. And we've come a long way since 2013, but we're not there yet. And so we need to keep on working on this and building our political power to move Medicaid expansion forward. And like I said, I think we're making progress, but we're not there. And the people who suffer suffer mightily for lack of access. And so I think probably for everybody that's on this panel, that's why we're doing the work, is because there are people who really are suffering without this access and not getting the quality of life that they should be getting, that everybody deserves and has a right to. So that's what I have for right now. Thank you.
Bruce, thank you so much. That's a great presentation. It gives a lot of information. And now it is time for us to hear from our national partner. Laura has stuck with us through thick and thin. She certainly has lots of states to work with, but we appreciate her being here tonight. So Laura, go ahead.
I'm very happy to be with you. And I too am from a non-expansion state. I'm here based in Texas, and I understand the push to continue working on this issue, despite it being difficult, because at the end of the day, people are still needing healthcare coverage. They're suffering both health-wise and financially, and so it's not an issue that we can really let go. But to give all of us hope, looking at it from a national perspective. We have had the large majority of states in this country expand, as you showed in your chart. 38 states plus DC have expanded. There are 12 remaining non-expansion states. There's one that's a little bit unique in Wisconsin, in that they actually chose to expand coverage to low-income adults, but to cover it at the lower FMAP rates, their traditional FMAP rate, instead of taking the higher FMAP rate of 90-10. So, Medicaid expansion is still important there because of some affordability issues and for their state budget, but there isn't a coverage gap like there is in those 11 non-expansion states. The thing that is on our side is that we now have over 10 years of data in other states showing the impact of Medicaid expansion, and the data is overwhelmingly positive. It dramatically reduces uninsured rates. It improves health outcomes pretty much across the board. It increases financial stability for people. And in many states, it has shown to be a fiscal positive for the state budget. So that's a fancy way of saying that states the majority of states are actually making money from doing expansion. So you can do a really good thing of increasing access to healthcare coverage for women, low-income workers, people with disabilities, mental health issues, a lot of groups that we know are falling into the coverage gap, while it not only, in most cases, doesn't cost you anything, states are making money. We did do a paper recently to look at the data in Montana, because we wanted to do a deep dive into a state that was more similar to Wyoming. So even though the national cumulative data all shows these really positive signs, what does the data look like in a state that is really, a lot more similar to Wyoming than some of these other states? But before I get into that data, I will say that, of the 38 states that have expanded Medicaid, it's included blue states, red states. Medicaid expansion has passed every time it's been put on the ballot. And it's really shifting into an issue that is no longer about whether states like Obamacare or not, but about how long it's going to take for your state to provide a coverage option to all of your people at all income levels and bring billions of dollars back to your state. So let's see here. When we look at Montana, the reason we chose it is a state with a less dense population like Wyoming, similar demographics, similar per capita rates of total state expenditures and tax collection. So it's probably one of the closer ones we can get. It also had more data. Unlike Idaho and Utah that expanded more recently, Montana expanded in 2016. And so there's many years of data to look at. So first things first, how does coverage look in both of the states? Back in 2015, before Montana expanded Medicaid, the uninsured rate in Montana and Wyoming were pretty similar. And actually Wyoming did a bit better. The uninsured rates in 2015 in Montana was 16%, and in Wyoming it was 14%. But when Montana expanded, they immediately reduced their uninsured rate by 1/4 in the first year. And over those next several years after expanding coverage, you saw Montana's uninsured rate continuing to go down. Wyoming's actually starting to creep back up a little. The COVID pandemic has and the PHE emergency has done a lot to shift those uninsured rates, but the trend continues. The ACS data came out a few weeks ago, and it shows Montana's uninsured rate at 8.2% compared to Wyoming's at 12.2%. And I always like to bring this back to what it really means, like on the ground to people. And so the next few data points are themes, themes that have been observed kind of across the board, across expansion states. But to think about that, it's what the folks in Montana are getting right now, and the folks in Wyoming are missing out on. In Montana and other expansion states, they're much better at reducing infant mortality. There is real data on this. They have lower 1-year mortality rates for end-stage renal disease. They have a lower late-stage breast cancer detection rate. Across the nation, at least 19,000 lives have been saved just from older adults. People have less medical debt, and there's been a large reduction in bankruptcies since Medicaid expansion. Many populations do better. Children do better because it turns out when parents have coverage, children are more likely to get coverage, use their coverage, and then a parent having coverage provides a lot of stability for the family, not only because the parent is able to get the care they need, think postpartum depression, think management of chronic diseases that might keep you from being able to work as much as you would like to because you're having to deal with those things without proper management. To just medical debt. When only one person in a family is uninsured, that family is at risk of really kind of diving more into poverty, just one illness away from diving more into poverty. And so we see children do better, both health-wise and their overall well-being. We see moms and babies do better because a lot of folks that fall into the coverage gap are women, particularly women of reproductive age. We see people with disabilities doing better because disability benefits in states are usually really strict. I know here in Texas, you essentially have to be in the last year of your life to be able to qualify, but we know a lot of people with severe chronic illnesses that can continue working for many years if they are able to get the care they need. And we see that across expansion states, that it has been a work support for people with disabilities and across populations. Rural hospitals do better. States that have not expanded Medicaid are 84%, the hospitals there are 84% more likely to close than in expansion states. There's improved access to mental health services, substance use disorder services, and then we've talked about coverage for women of reproductive age. So these are very tangible benefits that have been well documented. A few little points of items that people, some states and some legislators sometimes worry about for expansion. They wonder if it's going to have an impact on employer-sponsored coverage. We have not seen this across, there's no to minimal impact across the state, but when looking at Montana and actually Wyoming over the last several years, there's been not a lot of impact in both. In fact, Montana kind of increased their employer-sponsored coverage by a touch, and Wyoming decreased theirs by a touch, but both are so little that it really supports the idea that there is, that supports the data in other states that it does not have an impact in that area. Others have wondered if there's a big impact to the state's Medicaid spending. And what we've seen in Montana is that the annual growth of Medicaid spending has actually decreased 3 years after the expansion than it was 3 years before the expansion. What has increased in Montana is the amount of federal dollars that are coming into that state. So when you compare the growth in state Medicaid spending between Montana and Wyoming, state spending has stayed level, relatively level in both. In Wyoming, federal spending has stayed relatively level, but in Montana, federal spending has shot up. And so that means that represents the billions of dollars, millions, billions. I'm in Texas, so usually we deal in billions, but a whole lot of money that is coming into the state, that is stimulating economic activity, that is creating jobs, that is increasing revenue, et cetera. So now we get to how much it would cost to do Medicaid, and how much it has cost in Montana, how much would it cost in Wyoming. And this is where the paper we produced, and we can put a link to that in a little bit, really digs in. So we've covered in this presentation that the federal government covers 90% of the cost of providing care to people in the Medicaid expansion group, and states have to produce or put in the 10%. What we've seen in many states is, like I've mentioned before, is that they have experienced net fiscal gain. So how is that happening? One is because there end up being a lot of Medicaid savings when you expand Medicaid. And why is that? It's because the Medicaid programs in states right now are currently covering populations that could be covered by Medicaid expansion. And so you are shifting people from your regular FMAP rate into that 90%, which is, the largest really of any healthcare program, from that lower FMAP rate to the higher FMAP rate. So it is pregnant women, you're shifting them into that higher FMAP rate. Medically needy categories, limited coverage waiver programs like the breast and cervical cancer program. So instead of spending more state dollars on a patchwork of limited healthcare services, you are able to get a lot more money for your state dollar and provide a lot more coverage to that same population. Now in Montana, when you look at just these savings in Medicaid, they estimate there's two studies. One shows that you can make up 23% of that 10%, the state cost, just with the savings alone. The other study shows that you can make up 68% of the state cost. The estimate was 68%. Has a higher ability to capture complex spillover impact. The lower number itemizes each one, but doesn't consider the relationship between them and other spending. So that's the difference there. What's really interesting about Wyoming is that Wyoming gets a lower FMAP rate than Montana. Montana gets about 64% for your regular Medicaid, for their regular Medicaid program. Wyoming gets 50%. So what does that mean? If you are shifting populations from your regular Medicaid program into the Medicaid expansion group, while Montana gained a certain amount, Wyoming is going to gain, it actually ends up being 50% more than Montana. Because there is a bigger jump in the FMAP rates. So this is one way actually to increase the effective FMAP rate that you can get for your state, because you're able to shift populations into this much higher FMAP. So that's one set of savings, and we're going to be kind of doing a bit of a math problem. I'm sorry I did not have slides, but track it with me. You got 23 to 68% savings, knowing that those are Montana numbers. Wyoming's would be significantly higher. Then you have savings outside of the Medicaid program. So this is spending that states are doing for mental health services, substance use disorder, incarcerated populations, and there's a lot of details there, but all those are well documented, and programs for vulnerable populations. And so that translates to dollars the state is spending, state dollars, that they do not have to spend when people have more healthcare coverage. Across the nation, that number varies between covering 6% of the cost of Medicaid expansion to states to 41%. In Montana, it's at 17% the cost of expansion. So if we take that upper number, which I do like to do, 68% come from Medicaid savings, another 17% comes from savings outside the Medicaid program. You're at 85%, again, knowing Wyoming is going to be higher than that. But there are other categories here. The reason so many states are, that it has been financially positive for them to do Medicaid expansion is because it also often increases revenue when states have hospital or provider taxes or health plan taxes. So as more people gain coverage and there's more business in those areas, there's a resulting increase in tax that states can then use to help pay for Medicaid expansion. Some actually cover that and then have extra and are able to offset other state costs. Wyoming, my understanding is, has a hospital provider tax since 2017 and also a nursing facility provider tax since 2011. Montana has a hospital utilization fee, and the data there shows that just with that additional tax revenue alone, they're able to cover 18% of the state's share. So we had that 85%. We just added 18%. So if you take that higher estimate on the savings, Montana is well over covering their 10% share. If you take that lower end, I think they're at 58%, but remember, Wyoming's would be higher than that because the FMAP is less favorable for your state. There are a few other categories. The studies of the 12 non-expansion states have shown that there are, and actually all the expansion states show that there are reductions in uncompensated care costs. The particular study of the 12 non-expansion states shows that there would be an offset of 60%. Let me see. Actually, the study showed that the reduction in uncompensated care costs would offset 60% of new state spending for Medicaid. In Montana, it was 44%. And this is another place where you can really compare over the years what's happened in Montana and Wyoming. In Wyoming, over the years, uncompensated care cost has actually gone up. in Montana, uncompensated care cost has gone down. And today, uncompensated care cost in Wyoming is 3 times that of Montana. And then the last area where there is savings or additional revenue is the indirect impact on state revenue. So it is the additional revenue from all the jobs that were created and just additional spending from bringing, all the money, that 90% match home. It goes right into the community and is spent and contributes to that economic activity. And I really almost feel like a salesperson here to say, but the story almost doesn't stop there. With the American Rescue Plan Act, it added an additional sweetener to the 12 holdout states. It said it has a provision in there that for non-expansion states that newly expand, they will get an additional 5% FMAP bump to their traditional Medicaid population. So that is another way to kind of bump up the FMAP in the state and bring those additional dollars home. And estimates are between 70 and 81 million dollars. If that sounds all right. If that sounds right to my Wyoming friends here. So when you add all this up, if you take that very low estimate that Montana had in terms of their savings, you add in the ARPA, the sweetener, the ARPA funds, Wyoming would have the funding to cover about 10 years the potential cost of doing Medicaid expansion. In the more likely scenario that the savings are not quite that low, but they are more anything higher, but especially if they're more on the upper end, it really translates essentially to a financial windfall for the state. And the funding would indefinitely cover more than the 10% cost that Wyoming would have to spend to do Medicaid expansion. And I hope I haven't gone too long, but I'll just close with that this is a really good time to expand Medicaid before the end of the public health emergency. If y'all haven't been following that issue, for some listeners out there, because of the COVID pandemic, in order to protect people's access to healthcare coverage, especially as people were losing their jobs, the federal government gave states more money for Medicaid, but on the requirement that they could not drop anybody from healthcare coverage during the public health emergency. So people have not had to renew Medicaid for more than 2 years now, but we have to unwind the public health emergency. And so after more than 2 years, those renewals are going to start. And when they start, the estimates across the nation are that 15 million people are at risk of losing their healthcare coverage. About half of them are people that will continue to qualify for Medicaid, but will get disenrolled because of the enormous task that state agencies will have in renewing their population. And so what's going to happen in non-expansion states is that they're going to have a harder time than expansion states in curbing and stemming, limiting the rise in their uninsured rates, because folks, moms who have had babies, low-income parents whose income has gone up a little bit, children who have now become young adults and turn 19 are very likely to fall into the coverage gap, where in other states they will have another form of healthcare coverage. The other thing that is a really good reason to expand Medicaid before the public health emergency ends, which we expect to happen sometime early next year, is that states will lose that FMAP bump that they got because of the public health emergency, which was 6.2% points bump to the traditional Medicaid population. So that will have a financial impact in all states, but non-expansion states are uniquely positioned to get the ARPA funding from expanding Medicaid. So they get a 5%. They lose the 6.2%, but they have the opportunity to have some step down funding of that 5% FMAP increase, percentage points increase in their traditional Medicaid that can help really stabilize the unwinding coming out of that public health emergency. So thank you so much. I hope I didn't go too long, and I know this was a little complicated to follow, but please, or may have been a lot of numbers, please look at our paper that we have done on this. It's all there. And we also, I'll send another paper also that's our FAQ when the ARPA funding first came out on Medicaid expansion that really took the data across many states and kind of put it in one place.
Laura, thank you so much. Yes, we did math tonight, so that's great. And I do think that it's important. We've just got about 2 minutes left. But I would ask somebody quickly to talk about the federal match, which is what we're talking about, the FMAP. Can somebody break that down into a little bit simpler terms so that everybody on the call is on the same page with that?
Sure, I'm happy to do it. Think about having $1. Wyoming's FMAP is 50%. So for every 50 cents you all put in to for the Medicaid program you have, the federal government will give you another 50 cents, and you can push that dollar into the economy. The FMAP is so favorable for Medicaid expansion. That is why it's so easy to make up the small cost from the state side. For every 10 cents the state puts in, the federal government, you recoup essentially your own federal taxes in most cases. You get that 90 cents back, and you can send that dollar into the community. I had a business leader, a friend of mine one time said, I've never met a businessman I've never met a business person who didn't want to buy $1 for a dime. And that's what you're essentially doing with Medicaid expansion. You are being given that opportunity. Yeah.
Right. And can somebody quickly talk about why Montana's FMAP is different from Wyoming? What is the federal and state match based on? Quickly.
Yeah, so I could hop in on that. Yeah, essentially it's based on the average income of the people in the state. And so what we find here in Wyoming is we have Teton County, which has incredibly high incomes and drives up the average income for the state of Wyoming. And so I know I've heard Representative Harshman say something to the effect of if we just took out Teton County, we would be probably in the same spot as Montana in terms of the FMAP.
Okay,
unfortunately, yeah, if I can add one thing, unfortunately, the FMAP formula that's used is in statute, and it can only be changed by Congress. So for y'all's situation, it is helpful to think about how you can effectively increase your FMAP where opportunities exist. Medicaid expansion is one of those opportunities. Bringing those ARPA dollars essentially ends up increasing your FMAP either overall for some time or indefinitely for certain populations.
Awesome. Thank you. Well, thank you all so much for coming to our October People's Review Live. I'm now going to hand it back over to Celeste for closing remarks.
Awesome, thank you. And thank you all so much for being here, both attendees and panelists. We really appreciate it. Again, this is the People's Review Live, hosted by the Equality State Policy Center, a 501c3 nonprofit, nonpartisan organization. And as such, we rely on charitable gifts to fund our work. Donations can be made at our website, equalitystate.org, or by mail to 419 South 5th Street, Laramie, Wyoming, 82070. This event is also made possible by our People's Review Live Leadership Circle members, Marcia Constell and Joe Albright, Mike Shanzi and Kathy Jenkins, Joanne Skyam-True, Shane True, and Anonymous Donor. We're really grateful for them for making events like tonight possible. And We would also like to recommend, if you want to continue the conversation around Medicaid expansion, that you visit the Healthy Wyoming website, which is healthywyoming.org. With that, we will see you next month. Have a great evening, everyone.